Good day everyone, I am David Joshua Ebalilo, a nursing student from Our Lady of Fatima University. So today I'm going to perform a post-mortem care for our deceased patient. So first step is we're going to verify a doctor's order about the post-mortem care that we're going to perform, and we're going to let the doctor inform the relatives or family of the patient about of his death. And next is he can approach the family or relatives of the patient if they want to participate in our post-mortem care. If they want, they're going to sign a paper first before joining us. Then next is we're going to gather all the equipment. Sure that all the equipments have been prepared. Then hand hygiene. This will, even though the patient is dead, this will ensure that there will be no spread of microorganisms. Hand hygiene, then PPE for our safety also. First, we're going to identify the patient first by checking his ID band and comparing it for his medical record. Okay. Now, after we identify the patient, we're going to provide privacy. This will still ensure the patient's dignity even his after death. Then next, we're going to explain the procedure if there's a relatives that we're going to participate. And next is we're going to position the body, should elevate his head so that to avoid discoloration of face, and move it will grab. And next is we're going to close the eyes and mouth of the patient. This will also ensure dignity. Okay. And next is we're going to do a bed bath from head to toe. Move the linen. Throw the linen to the laundry bag or maybe in the trash if it's harder. I'm going to perform a bed bath from two arms, chest, and legs, and that we were done. Next is we're going to change the linen, of course. Before that, I forgot. Before cleaning the body, should remove any IV or anything that has been stuck with the patient, like the ID band, should remove it. And if there's any swero na tusok sa patient, kailangan din pong tanggalin. And also accessories that the patient using, like this watch. The patient's belonging will be set aside and will be given to his family or relative, and it will also be documented. Next is we're going to change the linen na. Then next we're going to put a cotton on the patient nose, ears, and also his eyes to now we're going to put cottons on the patient nose and ears to avoid necessary secretion. Because after that, there will be a secretion of the patient fluid in this area. So we're going to cover them with cotton. And we also need to cover the eyes with a tape. So, but I don't have a tape, so let's just assume that we've done that. Then next we're going to wrap the patient jaw to the head so that to avoid jaw dropping or chin dropping. Okay, assume that we're going. After that, the patient is ready to put in a clean shroud or a body bag. So assume that this is a body bag. If you have a nurse, other nurse as your companion, you can ask them for help to lift the patient and put inside the body bag. Assume that this is a body bag. Let's cover the patient. Now the patient is ready to be transported to the morgue. Now we're going to hand hygiene. Remove the PPE. And last thing to do is we're going to document the things that we did, the date, time, then it's going to add a patient tag for identification of the patient. Then after that, we're also going to document the accessories that have been removed to the patient and give it to the family members. And that's all. That's how you perform a post-mortem care. Thank you.